Hi, I'm Dr. Brian Higgins, and I wanted to talk to you today about a really interesting topic to me. It's called bioaesthetic rejuvenation. And what I mean by that is bioaesthetics is a word that was coined by Dr. Bob Lee, the founder of OBI. Bioaesthetics is the study of how our natural function of our teeth and our jaws, how they worked originally, the original design, what I like to call God's original design and function of the teeth. We look in great detail at what was originally there. And then rejuvenation is a good word because we're revitalizing these people's mouths. We're not just restoring back what's been lost, but we actually see a reversing in the age of the face, the way things were back when things were functioning better in their youth. It's really exciting, and you'll see what I mean in some of these before and after pictures. There's some basic principles that are involved in bioaesthetic rejuvenation. First of all, the joint, like any other joint in the human body, wants to be in socket. So we try to get that in socket, healed and stabilized. And we have to take the function of the natural teeth into account also. Our front teeth are single-rooted teeth. They're designed to do all the guiding forces of the teeth. They're designed to do the front forces when we come forward. They're designed to take the forces when we go side to side. Yet the back teeth can't handle any of these side-to-side forces. They're designed best, they're multi-rooted teeth, and they're designed best for chewing forces, straight up and down. They can take that kind of force all day long. But they can't do the side-to-side forces very well. So we have to have everything in an ideal form to work together. In a following video, I'll talk to you about the details of the Mago splint therapy, but realize that the basic principles are to stabilize the joint, get the condyle back in its in-socket position, heal the joint tissues and expel all the inflammatory fluid, and create a balanced protected occlusion on the splint that allows the muscles and the tissues to return to a healthy, more relaxed position. We open the vertical dimension back to what was in the unworn condition, and we try to get a preview of what our incisal tooth form will look like, the length and the shape of the teeth when we restore them back to ideal. And if you think about this complex system that we're dealing with here, it starts to make more sense. The hardest substance in the human body is the teeth. And if the teeth are malaligned, then we're going to have problems in the other tissues. All the softer tissues have to compensate for that. Even the bones are softer than the teeth. The muscles, the soft tissues, the nerves, all of that has to compensate for any problem of how the teeth are aligning together. Conversely, if we get the teeth lined up ideally, then all the other tissues can relax and function as they were designed, back to a more normal, healthy condition. Some magical things happen when we are carefully restore the patients like this. This is a 3D tomogram of a patient's airway, and this cone beam shows the patient on the left is pre-therapy, and they have a very constricted 76 millimeter maximum airway or minimum airway space. After the therapy, the airway opens back up to over 200 millimeters. But what you also see in this picture, notice the curvature of the spine has decreased. The patient looks like they have a better head posture. Everything looks to be functioning in a much better, more stable position. And I've seen some magical things in some of these patients. I had a wonderful lady who was a retired opera singer, and she told me after restoration that she could hit notes that she hadn't been able to hit since she was 16 years old, that her voice warmed up faster, that the youth and vitality of her voice came back. And it was a real treat to hear that from her, and interesting when you think about how all of this stuff is interrelated. And another woman who always had had trouble swallowing pills, and after we restored her mouth back to a more stable condition, she could swallow pills very easily. Her swallowing mechanism worked better because the whole system was stabilized better. And you'll see some amazing changes in some of these faces as we go ahead. This is a picture of a Mago in place. This is a special kind of a digitally designed Mago called a bioorthosis. And what we can see with this, the bite on the left has been collapsed and worn over time. So we've gained back the vertical dimension we want. And what we're thinking about is just how far apart are the teeth. Think of how far apart is the nose and the tip of the chin. Or the way we measure it is from the top of the top teeth to the bottom of the bottom teeth. How high is that number there? And we're trying to get this back to what was probably originally ideal for this patient. And you can see we have all the guiding forces and everything in place on this Mago. Some magical things happen to these patients when we start restoring them back to the way they should be. Look at this nice young man, how he has a little bit of tension around his eyes and a little bit of wrinkling in his forehead and stuff, even though he's a young man. With the imago in place, look at how his face changes. His eyes open up, the wrinkling disappears. His face looks like it's more relaxed and healthier. This young man, again, nice smile, but there's some tension around those eyes. Put the imago in place, look how the eyes open up. Look at how the tension and the face feels more relaxed. He just looks almost like a different person in the second picture. Same thing here. Look at the tension, and it almost looks like some pain around her eyes. With the imago in place, the eyes open up, the face relaxes, some of the wrinkles disappear. It's magical what happens on these. This case is one of my favorite ones for before and after. Look at the head tilt, the crookedness of the eyes, the jaw out to one side. Put the imago in place, and he straightens right up. His eyes open, his face relaxes, his jaw becomes stable, his head position is better. Everything's working the way it's supposed to. The other tissues don't have to compensate for something wrong with the bite. And this is a man that's been restored all the way after imago therapy with restoration. And the picture on the right is the after picture. It was taken 1.5 years after that first picture, yet he looks younger 1.5 years later. A lot of the wrinkling and tension around the eyes has disappeared. The face is relaxed more, and it just brings back some vitality. This woman has a very nice smile before treatment, but look at what happens after her bite is corrected. Her face relaxes, her eyes open up. She looks at least 10 years younger. Who wouldn't be happy with this result? It's just exciting what we can do in this. Again, the tension around the eyes before treatment, the relaxation, the eyes opening, the face relaxed after treatment. This young woman took very little to restore her back to ideal, but yet look at how her face comes alive after the treatment. Look at that smile, it just jumps out at you. And this one is one of my favorite ones. Look at her eyes before treatment. There's pain in those eyes. Afterwards, that's a new person. The eyes open up, the face relaxes. She almost looks like a different person afterwards. That's the way her face should be. And that's why this kind of treatment is so exciting to me. If you want more information on this, you can contact me at my office in Saratoga at higginsdentistry.com, or contact the OBI Foundation on their website, bioaesthetics.com, or information on the imagos can be found at Natural Aesthetics website, natural-aesthetics.com. Thank you very much.